Breaking news update, let's get right into it. Day 6 of the government shutdown, there's a new twist. Donald Trump says he's open to a healthcare deal with Democrats. That's a big signal. Talks have mostly been stuck on spending immigration. Healthcare entering the chat could change the math. Here's the headline version. Trump is signaling he'd consider a bipartisan move on healthcare in exchange for progress on reopening the government. It's early, it's messy. Details aren't locked, that's the door he just cracked open. Why this matters right now? A shutdown hits in waves. Essential services keep going. Federal workers face delayed paychecks. National parks get limited. Loan processing slows. Small business approvals can stall. The longer it lasts, it ripples through flights, research grants, food safety inspections. So what does a healthcare deal even mean here? Shoring up subsidies to bring down premiums, funding community health centers, lowering prescription drug costs, targeted fixes to stabilize insurance markets. Nothing official yet. This is a trial balloon moment. Democrats will likely say they'll listen if there's real money and real policy that lowers costs or expands care, but not if it's a swap that cuts elsewhere. Republicans could split. Some may back a narrow, cost-lowering package. Others won't want health care tied to shutdown negotiations at all. If a deal forms, what would it look like? Best case, short-term spending bill to reopen government, plus a modest bipartisan healthcare add-on everyone can sell back home. Worst case, more posturing. No text. Roll into day 7 with the same stalemate. What changes for you immediately? If the government reopens, federal workers get paid, backlogs start clearing, services ramp back up. If it doesn't, expect more delays, more uncertainty, growing pressure on Congress as costs stack up. Keep an eye on 3 things. Exact language around any healthcare proposal. Numbers, timelines, who benefits, whether House and Senate leaders agree on the same path, or run parallel tracks that collide. The clock. The longer this runs, the harder the politics get, the more expensive the fix. Signals to watch tonight. New statements from Trump. A joint outline from negotiators. A draft bill. Draft mentions premiums. Draft mentions drug prices. Draft mentions marketplace stabilization. If text drops, it's real. If it's just quotes, it's still vibes. Bottom line, day 6 is the first sign of a pivot. Healthcare is popular to solve. Healthcare is painful to politicize. That makes it a risky but interesting bridge to end a shutdown. If both sides can claim a win, lower costs for families, and a reopened government. If they can't, tomorrow looks a lot like today. I'm watching for concrete proposals and a vote schedule. If those land, I'll break it down line by line so you know what actually changes in your wallet and your week. Stay tuned. Stay safe. If you're a federal worker or contractor caught in this, hang in there. I'm tracking updates by the hour. I'll be back as soon as we have hard details.